Welcome to South Texas Behavioral Health Center. We want you to know that we are here to help you and to give you the best care possible. For more than 20 years, South Texas Behavioral Health Center has helped people discover how to effectively cope with varying behavioral health conditions and addictive disorders. We offer 130 beds for child, adolescent, adult, and geriatric patients, and we are the largest private inpatient program in South Texas. In addition, our intensive outpatient treatment program can assist you with problems that make it difficult to carry out your day-to-day activities. The IOP setting allows patients to benefit from a more flexible treatment environment while continuing to work and live at home. We are committed to providing compassionate, quality care in an atmosphere that can assure patients will reach their optimum level of functioning. Our teams develop individualized treatment plans that lead to a path to recovery. South Texas Behavioral Health Center offers exceptional behavioral health care programs and treatment services for children, adolescents, adults, and older adults in both inpatient and outpatient settings. Our treatment approach is multidisciplinary and individualized, and each person at South Texas Behavioral Health Center is treated by a team of professionals led by a high-qualified, experienced psychiatrist. The Teen Discovery Treatment Program for adolescents ages 13 to 17 assists in exploring positive options that lead to positive choices for teens. Program features distinct program focus, managing anger, improving coping skills, enhancing relationships, treating depression, severe mood swings, self-mutilation tendencies, defiant behavior, chemical dependency, thoughts of self-harm or harm to others, and aggression. Recreational therapy, comprehensive discharge planning. South Texas Behavioral Health Center offers exceptional behavioral health care programs and treatment services for children, adolescents, adults, and older adults in both inpatient and outpatient settings. The beauty of children lies in their playful demeanor and innocence. However, life's changes can affect our children in ways that cause stress or misbehavior. The Kids Early Discovery Treatment Program at South Texas Behavioral Health Center treats children ages 3 to 12 and focuses on early detection and intervention of behavioral health issues. Children learn ways of coping, and parents learn how to guide them. Our treatment approach is multidisciplinary and individualized, and each person at South Texas Behavioral Health Center is treated by a team of professionals led by a high-qualified, experienced psychiatrist. Adults strive to be productive and emotionally fulfilled. At times, life's trials can distract from physical and emotional balance. Guidance and support are essential to regain focus. The Better Living Treatment Program provides reinforcement needed for adults ages 18 and older to make sensible choices. Program features distinct program focus, coping with depression, managing anger, improving coping skills, enhancing relationships, balancing severe mood swings, complying with medication, chemical dependency detoxification, treating depression, thoughts of self-harm or harm to others, and self-mutilation tendencies. Comprehensive discharge planning. We are committed to providing compassionate, quality care in an atmosphere that can assure patients will reach their optimum level of functioning. We will be right with you. Thank you for choosing South Texas Behavioral Health Center. Welcome to South Texas Behavioral Health Center. Our goal is to make your admitting experience as pleasant as possible. If you are here for an assessment, a behavioral health professional will meet you and review a series of questions to determine your or your loved one's level of functioning. This is an opportunity for you to share with us your symptoms, your stressors, and any treatment history you may have. Please be assured that the information you provide will be confidential. Therefore, make sure to give us details regarding your status so that we can make an accurate recommendation to meet your needs. Examples of questions include areas of functioning such as sleep patterns, eating patterns, mood, and stressors. With children, it's important to provide vivid details about issues relating to behavior. For example, if your child has been aggressive, we would ask, when was the last episode of physical aggression? Against who? And their age. Was there any injury caused? If so, what type? Please be very honest with your responses. This will help us help you more effectively. We accept Medicaid, Medicare, private insurance, and those who want to pay for their own treatment. Please be assured that if you do not have the ability to pay for your services, we will help you get the help you need. If it is determined that you do need to be admitted, the following process will take place. A psychiatrist will be contacted to be advised of your status, and he or she will provide an order for you to be admitted. Texas law requires that any patient who is admitted to a psychiatric hospital needs to be seen by a doctor before they are admitted. The doctor does not need to be a psychiatrist. If you have not been seen by a doctor in the last 2 days, we will arrange for you to be seen by a doctor who will clear you for admission. If you were referred by your doctor, he or she may provide you with a referral which should be provided to the admitting staff upon your arrival. If you have seen a doctor in the last 2 days but do not have a written referral, please let us know, and we will contact them and make the request. If you were referred by an agency or your doctor, we may ask for permission to communicate with them regarding your admission or evaluating outcome. This can only occur with your permission. If you are an adult and want your family member or friends to have information about your treatment, you must also provide written permission to do so. If you are not the biological parent of a child or guardian of an adult who is being admitted, please provide us with written proof of your guardianship status. As part of our goal to maintain patient and family safety at all times, you will be asked to allow us to secure your personal belongings, and you will be asked to give us any items in your possession: lighters, sharp objects, belts, shoelaces that could pose a risk hazard. These items will be secured by placing them in a cabinet in the room you are in and will be returned to you after your assessment is completed or you're admitted. What will you need if you are admitted? Please refer to our patient handbook for specifics regarding items that you are allowed to have while you are a patient. We suggest that you bring socks and a light jacket, as it does tend to be cold in the units at various times of the day. Personal items such as toothpaste, toothbrush, soap, and shampoo are provided. If you choose to bring your own items, please keep them to a minimum amount. Outline of course treatment. As a part of your treatment here, you or your loved one will be visited daily by a psychiatrist for medication management, except for 1 day out of the weekend. Parents will need to consent to any administration of medication, supervised by a nursing staff 24 hours a day, attending group and activity therapy. Group therapy topics cover education of symptoms and effective coping techniques. Assigned a social worker or licensed professional counselor who will coordinate discharge planning. A family session will be scheduled for all children. The benefit of inpatient treatment is the observation of symptoms, behavior, and responses to medication if prescribed. It allows professionals to make an accurate diagnostic assessment and outline an appropriate plan for treatment that will ensure recovery. If there are any concerns after you have been assessed and referred or admitted, the Assessment and Referral Department is here to assist you. Thank you for choosing South Texas Behavioral Health Center. We will be right with you.